We're going to be talking about the need for Black people, especially, to take this vaccine that's come out. Certainly, you are in agreement with that, are you not?
I am certainly in agreement with that, Mr. Bibb. When you think about what's happened to the Black community, four times more likely to be hospitalized from this COVID virus, three times more likely to die. This suggests that it's disproportionately impacted our communities in ways that one can't imagine. And we all know of someone who's lost a friend, a family member within the Black community.
So there are disparities that we're dealing with, aside from just trying to get the vaccine and get it in the arms of people. There are racial disparities out there that we have to deal with.
Absolutely. You know, when we look at the continuum of this pandemic, we started out with this idea that we're disproportionately impacted. We wanted to make sure testing was available to Blacks within our community. And that was the first struggle. The second struggle was the vaccine. Well, when the vaccine comes, we want to make sure that it's not disproportionately and inequitably distributed to non Black communities. We want to be in line. And now we're faced with having a vaccine, and we want to make sure that people are willing, informed, and able to access the vaccine.
Mhm. We are dealing with some history out there where blacks were abused and misused medically decades ago, namely that Tuskegee syphilis thing that went on in the 1930s until the 1970s. How do you overcome that real fear that some people have that they could be guinea pigs once again, or that they're being given a bill of goods about how good the vaccine is?
Absolutely. No, certainly there's a lack of trust, and that lack of trust has a factual root to it going back 400 years, you know, to slave times and these experiences that have been passed down through generational. And we talk about the United States healthcare Tuskegee experiment, and we hear about that most notably. But even recently, we think about Flint, Michigan, and the water issue and crisis that disproportionately affected blacks and poor whites in Flint, Michigan. And we know that there's a context to this distrust. The fact is that, you know, Black Americans, me included, have grown up with this idea that the table is not level set in terms of how we receive healthcare. We all have stories, we all have experiences, and this all takes place in what we experience each day in microaggressions and macroaggressions, and what's out there for us to not believe that this is present within healthcare.
So you hear the distrust. How do you get around that distrust? How do you get people to sign on that the vaccine is good and that they will not be abused because of race, or will not be abused at all because of it?
Yeah. I think there are several steps to that. And I think we're starting to see, I don't want to make this a political conversation, but we're starting to see with the emergence of science leading the way. There was this idea that this was a political disease, if you will, over the past year. And now, with scientists starting to lead the way and provide information and not be obstructed, Dr. Fauci as a primary example, we have to emphasize the idea that this vaccine is very safe and very efficacious. And what I mean by efficacious, when we look at our flu vaccination, in a good year, we can hope that that will be 50 to 60% effective. When we think about these vaccines that we have available under emergency use authorization, they're 90 to 95% effective. And so this technology, which is, by the way, not new technology, some people ask the question, well, how come in 1 year we're able to get to the point of having a vaccine? They must have cut some corners. This is medical technology that has been used in other areas of vaccine development for over a decade. And it's just that this technology was converted to the idea of focusing it on the COVID 19 development. So this is not new technology, right? So first of all, let science lead the way. Secondly, we have to use some trusted voices. We all know that there are various levels of trust. There's the trust that one might have with their physician. There's the trust that one hopefully has with their healthcare system. And then there's the trust that we have in society. And I would say at this point, we all agree that there's a historic lack of trust. And this is not just amongst Black Americans, this is amongst all Americans in institutions and society. So we have to go back to this idea that most of us trust our physician. We may not trust society, but we have a relationship with our physician. And especially, we have some very good data that's taken place over time that Black patients that have Black physicians trust their physician to give them, a true story about their healthcare and recommendations around their healthcare. And so we have to look for those people in the community, whether it's a African American physician, whether it's that church leader, whether it's other trusted organizations that we as healthcare providers can stand up, provide them with the information, the factual information to disseminate and distribute to the community.
So you are applauding, it sounds like you are applauding those community leaders, those religious leaders, those civic leaders in the community who are Black, who are well known, who are saying they're taking the vaccine and they are suggesting that the rest of the public do as well. You
Absolutely. I think that's really, when you look at our community in Cleveland, I think that's the role that the Cleveland Clinic serves, is to provide that information, arm those individuals with factual information so that they can go out and evangelize about how this vaccine can help Black communities. We really need to get it into the arms of Black members of the Cleveland community.
Okay. Is there anything I need to know that I have not asked you that you think is important to what we're talking about?
Well, I will tell you one thing. This is something that I've heard from friends, from family members, Leon, that, well, I'll just wait. I'll just wait and see what happens for 6 or 9 months. This has been a little bit too quick for me. And I tell them, think about this. If I told you that we have a disease that there's a 50% chance if you get it, you'll be in the hospital, and a 25% chance that you'll be in the intensive care unit. And I told you that we had a treatment for that disease, but I told you that we were going to let Black folks sit in the back of the line and just wait it out. How would we feel about that? We'd be up in arms. How could this happen? You know? And so this is an effective, safe and effective vaccine that has the potential to help our community. And when I think about it, I think about the fact that if I get the vaccine, I'm not just helping myself, but I'm helping my auntie, I'm helping those older folks within my environment that may be more susceptible to severe COVID infection. And so I think about it as more of a potentially selfless process, and everybody taking care of themselves so that we can have a safe community, and so that we can potentially move on from this, get back to our social activities, get back to work, open up our business economies, because we know Blacks have been disproportionately affected in their wallet, in their pocketbook as well. So there's so much upside to us getting this information out and getting high scale acceptance of this vaccine within the community.
I got a final question for you. My wife is listening to this interview right now. She's not too far, right around the corner here in our home, and she's going to take the vaccine later on this afternoon, probably in the next hour or so. She's got an appointment, and she just sent me a note: how to calm your wife prior to the vaccine. She wants to know how can you calm her. She's listening to you right now.
Yeah, absolutely. I will tell her that I had my vaccine. I'm a firsthand example. I had my vaccine. It was no different than the influenza vaccination or any other shot that we've taken. Relatively painless, and I think the anxiety is understandable. But the upside of being able to get back to some normalcy is what people have to keep in mind. And so God bless your wife, and I wish her the best of luck. And I'm very happy that she's taking this vaccination.